Goni skill, knee extension. Position the patient supine with the knees extended. Make sure the hips are in 0 degrees of extension, abduction, and adduction. Place a towel roll under the ankle to allow the knee to extend as much as possible. In patient-appropriate language, ask the patient to extend the knee, assess the femur to prevent rotation, abduction, and adduction of the hip if necessary. Hold the patient's ankle in one hand and stabilize the distal femur with the other hand. Using the hand around the ankle, extend the knee joint while you apply a counterforce on the distal femur. The end of range of motion occurs when resistance is felt. Assess the end feel of the joint, which should be firm because of the tension in the posterior joint capsule, the oblique and arcuate popliteal ligaments, the collateral ligaments, and the ACL and PCL. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the lateral epicondyle of the femur. Recall the technique taught in lab to identify the lateral epicondyle. Align the stationary arm with the lateral midline of the femur using the greater trochanter for reference. Again, utilize the technique taught in lab to identify the greater trochanter. Align the movable arm with the lateral midline of the fibula using the lateral malleolus. Ask the patient to extend the knee as previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the hip. Read the degrees of motion on the goniometer and then ask the patient to return the leg to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion according to the American Association of Orthopedic Surgeons is 10 degrees. Recall that not being able to extend the knee fully will result in a negative degree documentation.